Hello everyone, I'm Urologist Ömür Erdem Akkaya. The subject we will talk about today is penile shockwave therapy. Which patients can have it? Which patients will benefit from this? What kind of treatment is it? Shockwave therapy is a treatment performed by touching a hand tool that produces shock waves to the penis and transmitting the shock wave to the penis. It can be done for 5 or 6 months, 1 or 2 sessions per week. It varies according to the protocol of this tool's brand. There is no single protocol valid worldwide, we should say that. When we apply the shock wave to the penis, a series of events begin to develop in the penis. New vascularization develops. Oxygenation and blood supply of the penis tissue increases. And of course, there is an improvement in the erectile function of the penis and a decrease in complaints about erectile dysfunction. How long does the treatment last? These improvements occur a few months after the shockwave is applied. During shockwave therapy, patients usually also use PDE5 inhibitors such as Cialis and Viagra. The patient gets a good response from Cialis or Viagra in the first month. Actually, the response is from this 5 mg tablet tadalafil. Later on, patients can see the benefit of this shockwave therapy. So when we look at the scientific studies conducted in the world, how much benefit did the patients see? The latest study was conducted in Japan. They compared the Renova brand with ED1000. In patient satisfaction, they got a result of 71% in Renova brand and 65% in ED1000. For example, in a study conducted in Egypt, they tried a Wolf brand device and patients benefited by 59%. But there are many studies on this subject and the results are so far apart. For example, there are also publications on this shockwave that show that the shockwave does not show any benefit. This is the reason for the question marks in the minds of both patients and doctors. In other words, the results of publications and studies are very different from each other. So what do the competent institutions in the world say about this shockwave therapy? The American Urological Association says, it is currently an experimental treatment, it has no place in treatment protocols. The European Urological Association says, no, we also offer this in the treatment protocol for erectile dysfunction. Patients may benefit to some extent. The European Urological Association accepts the treatment. The American Urological Association does not accept the treatment at the moment. According to my own clinical experience, it is obviously not a treatment that should be applied alone in patients. It is absolutely necessary to add supportive treatment. The patient should be evaluated as a whole. It can form part of the treatment protocols. PRP treatment can be given together with the shock wave. The patient's life habits can also be changed in a good way. Testosterone levels can be raised above physiological levels. With many changes, it can really be put into the patient's treatment protocols related to erection and sexuality. Because some patients can get really good results. In fact, success rates are 60 to 70%, these rates should not be underestimated. If the patient is using tadalafil or sildenafil, which are PDE5 inhibitors and cannot feel enough pressure in the penis during intercourse, shockwave therapy can change this. For example, the patient has taken tadalafil or sildenafil, but cannot get erected enough. After shockwave therapy, he can achieve a better quality erection. Or he can stop taking tadalafil and sildenafil, he can become able to have intercourse with his spontaneous erection after shockwave therapy. But as I said, shockwave therapy is only a part of the treatment protocol. It is never right to say you will definitely benefit or you will definitely not benefit. As I said, the most important factor in the effect of shockwave therapy is that if the patient has advanced erectile dysfunction and advanced age. Because it negatively affects the response from the treatment. Apart from that, it is a treatment that can be applied in patients with mild and moderate erectile dysfunction. But as I said, it is absolutely necessary not to put the patient in a very high expectation. Thank you for listening. Best regards.